Ayurveda has been seeing a sudden surge in demand ever since the COVID, and thereafter, the Ayurvedic superherbs like Triphala, Ashwagandha, Shatavari, and Shilajit has been all over the social media. But is it for all? Could you be going wrong by consuming these on a regular basis? Let us try to explore these in today's episode. Let's begin with Triphala. Triphala is popular amongst all those people who are regularly struggling with constipation. It is an amazing antioxidant-rich combination of 3 herbs, Haritaki, Vibhitaki and Amalaki. One is rich in vitamin C and all other rasayana properties, which is Amla. Haritaki is an excellent laxative and Vibhitaki helps you with shrinking your weight. So what can go wrong with Triphala? You often experience bloating, incomplete evacuation and indigestion. In that case, Triphala is going to be helpful in relieving the constipation. Having a teaspoon of Triphala at bedtime with a cup of warm water approximately after 2 hours of dinner helps you in relieving constipation. But when consumed by those who are experiencing weight loss, extreme dry skin, dry hard stool, then in that case, it is going to further worsen your constipation, and that is because your intestine is already dry and the peristaltic movement is quite hampered. Now, when you have Triphala, it further dries your system. Thereby, the proper effective movement of the feces through the intestine doesn't happen. In that case, you are not eligible for Triphala. If at all you're still particular about having Triphala, you got to mix it with cow's ghee and then consume at bedtime. That is going to help you with your eye health and also acts as a good rasayana. So what is meant by rasayana? Rasayana is a herb which has got therapeutic effect as well as it has the ability to help you with regeneration of cells or tissues. In other words, it helps in delaying aging. The second herb of choice, Ashwagandha. Ashwagandha is very popular amongst those who are struggling with stress, anxiety, insomnia. You are even going to get amazing results with the same. But in some, it can be counterproductive. It can give you diarrhea, bloating, weight gain, joint pain, and even palpitation. That is because Ashwagandha, if you see, is a root, and upon boiling it with milk, which is a right way to consume Ashwagandha, it tends to give you the Brahmana kind of property. When I say Brahmana, it means it helps in nourishing your body. So typically, somebody who is struggling with extreme weight loss, stress, insomnia, who has been repeatedly taking night shift, then in that case, Ashwagandha is going to be beneficial for you. But in case if you have been experiencing insomnia, palpitation, weight gain and sluggishness and heaviness of body, and you try including Ashwagandha in your system, what happens is it leads to kapha imbalance. In other words, it makes you gain further weight and more of ama or inflammation because it is not suitable or rather required for your body, and especially when it is being consumed along with milk, which is the right way to be had, it will lead to the further kapha imbalance. So before you pop in Ashwagandha, just because you are going through insomnia stress, try connecting with your physician, try and understand what your body type is, and then introduce it for a short period, at the most a month or 3 months, depending on the extent of vata imbalance or stress in you. Next super herb, Shatavari. Shatavari stands for somebody who can handle 100 husbands, which means it makes you a super woman. And that is because it acts as a uterine tonic, helps in maintaining the female reproductive hormones. Unlike any other herb, it is good for menopause. In other words, it delays menopause, and it also helps in the development of breast. Now, that being the case, how can Shatavari go wrong? Now, these properties of Shatavari is because of its Tarpana and Brahmana property. It has this milky texture. It's a tuber which when boiled with milk makes it thicker, which is exactly what also helps in the galactogogus property of it, which means it helps in the breast milk secretion. If a person who is already going through excessive weight gain, increased bleeding during periods, and are heavier in size, then in that case, it's going to give you kapha imbalance and inflammation. So before you consume Shatavari, you need to identify if you are suitable for the same. If you have been experiencing sporting prior periods, especially from ovulation to menstrual cycle, if there has been excessive pain, delayed cycles, or there is decreased or scanty flow, then in that case you are suitable for Shatavari. But then again, it should be consumed only after the initial anti-inflammatory management, which is applicable to almost all kind of herbs, especially Rasayana herbs in Ayurveda. If somebody has been experiencing delayed puberty or delayed changes in the body which are ought to happen from puberty to menarche, or somebody has been experiencing perimenopausal changes from late 30s, say from the age of 36 to 38, if you have started experiencing perimenopausal changes like hot flushes, weight gain, irregular periods, scanty periods, then in that case you can include. Again then, during the middle age, especially from 25 to 35, unless and until you are going through severe stress, this herb is not required for you. Last and the most popular, or rather a little notorious herb amongst the gym goers, which is Shilajit. Shilajit has suddenly taken up all over internet for the simple reason that it is good for improving stamina, improves sexual functioning in males, and also it helps in tackling the diabetes-related complications. Shilajit, which is formed from the decomposition of plants over thousands of years in the Himalayan region, is one tough to be obtained. So the first thing that you need to consider is, are you consuming the original one? Because the original one will have a cow's urine kind of decayed smell attached to it, and it will be sticky and resin-like. Second, if your body has not been prepared for the consumption of a Rasayana herb like Shilajit, which is rich in iron, then in that case it can become counterproductive, as in it can increase the body heat, and that can also increase the iron levels, which may not be required for all. So you need to figure out whether your body is suitable for that. Initial cleansing and preparation of the body is inevitable, and once you start consuming a Rasayana herb like Shilajit, ensure that you're taking the right kind of precautions. One, you're not dumping your body with all kinds of junk food, because junk food and the Rasayana herbs do not go hand in hand. Two, you are not overdoing protein, which is exactly what most gym goers do. So if you are doing that, kindly avoid having Shilajit. And three, it is best to be consumed by the kapha or the vata kind of population, and not the best recommended when there is major pitta imbalance. Yes, if there is pitta imbalance, you can treat yourself and consume, but then again, ensure that your doctor approves of the same. So you can consume Shilajit provided you are extremely fatigued, tired, or in case of chronic fatigue syndrome, Alzheimer's, long-standing diabetic complications, especially kidney failure. In that case, it is recommended for you, but you got to consume it with the right kind of anupana, which means a supportive herb, specifically milk or Triphala concoction, and minimum for a period of 1 year. So by now, I'm sure that you have got a fair idea how important it is to know when to consume which herb, even if it be a super herb. Hope that helps.